So which is why if you're using this drug, you need to use it cautiously. Minoxidil. It's a hero for some and it's a villain for many of us. I used to use Minoxidil for male patients in my practice earlier, but nowadays it's something which we use very cautiously. Some patients, they benefit a lot with Minoxidil if it suits them. But sometimes patients have a lot of hair fall in the initial phase of using Minoxidil. That's the truth. And that is why we don't use Minoxidil for our female patients. It is a good option, but it has to be used under caution. And you need to understand that if you stop using it abruptly, you may lose a lot of hair. There is a percentage of patients who might actually lose more hair than what they began with. So which is why Minoxidil should either be avoided in females, or if we are using it, it needs to be used under the supervision of a dermatologist, and that too very cautiously. Though there are so many articles in scientific literature which are in favor of Minoxidil, but we need to understand that one size doesn't fit all. With people from different background, with people from different kind of lifestyle, we need to understand that Minoxidil needs to be used in a typical and peculiar manner, and it needs to be tapered rather than it needs to be stopped. So which is why if you're using this drug, you need to use it cautiously. In my practice, we don't rely on Minoxidil. We usually use the botanical options which are as good as Minoxidil and maybe better than it, and it gives the best result without having any kind of side effects, without having any kind of adverse reaction which are common with Minoxidil because of the property of allergic contact dermatitis which happens in certain percentage of patients who use Minoxidil.